Well, good afternoon, and thanks to all of you for joining us today. It's good to be with you again. We plan on this being a short briefing today. Get it? Short briefing today? All right. I want to touch on our health metrics, number one, reopening plans for higher education, and our revenue numbers for the month of May, and what they mean for our financial planning as we move into the latter part of this year. But first, I want to speak briefly to the ongoing protest and the Confederate monuments. I have said that I believe Confederate monuments are divisive and glorify a racist and painful time in our history. That's why we are working to remove the Lee Monument in Richmond, which our state owns. The Richmond City Council has also agreed that it will remove the other Confederate monuments that are on Monument Avenue. We all came together to create a process to do that safely. We need to let that happen because these statues are very large and they're very heavy. In Portsmouth, a demonstrator was seriously injured when he was hit by a statue that was being pulled down. I know these statues are causing a lot of pain, but pulling them down is not worth risking someone's life. So let the local governments take the responsibility for taking these statues down safely. Let's do this the right way and keep all Virginians safe. The statues are, of course, far from the only racist and divisive relics of our past. So now let's turn to our ongoing work of reform. As you know, I created the commission to examine racial inequity in Virginia law last year. We know that racism and discrimination were written into our laws, particularly during the Jim Crow era, with the intent of enforcing segregation and subjugation of black and brown Virginians. And while many of those old laws have been overturned, in some cases the language remains in the Acts of Assembly. In just a partial review of those acts, the Commission found nearly 100 instances of discriminatory language. We proposed legislation to remove those ugly words from our law books, and it passed just this past year unanimously. Today, I'm announcing that I'm extending the work of the Commission and broadening its scope. The Commission will now look at current state laws and regulations that create or perpetuate inequities, with a focus on public safety, criminal justice, health, housing, and voting. It will propose changes to increase protections for minority and marginalized Virginians and provide policy recommendations for state agencies and institutions. I am very proud of the work the Commission has already done and look forward to seeing their proposals. We expect a report with recommendations by November the 15th. Now I'd like to turn to our COVID-19 health data. We've all seen news reports over the past couple of days about increasing coronavirus cases in several states. I'm glad to say that so far, Virginia is not seeing a spike in our cases. In fact, our metrics are continuing to trend downward. I specifically want to show you a couple of those measures. This first slide, you see the total cases by date reported. The yellow line is the 7-day moving average. Our total cases have been trending downward since the end of May. This next chart shows us how many people in Virginia have unfortunately died from this virus. I don't often show this chart because deaths are what the scientists call a lagging indicator. They don't tell us about the current spread of the disease. That said, I want to note that as you can see from the yellow line, the number of COVID-19 deaths being reported to our Virginia Department of Health has been decreasing in the past couple of weeks, and I find that a very hopeful sign. In this next slide, you'll see the number of people tested, the number of positive tests, and the percent of tests that are positive. As you can see from the yellow trend line, our percent of positive tests has been trending downward for some time and was 8.9% at the beginning of this week. In comparison, its peak in the past, as you can see, was well over 20%. So we have made a lot of progress. And so we feel good about how these trends are going. That said, I cannot emphasize strongly enough that this virus is still with us, and everyone needs to continue to behave cautiously. We are 1 week into Phase 2, and Northern Virginia and Richmond will go into Phase 2 tomorrow. This means there are more places that you can go, and we all need to be very vigilant about protecting ourselves and each other when we go out. Cover your face, wash your hands, and please continue to stay 6 feet away from other people if at all possible. In addition, we have thousands of people out at protests where they are close to other people. I understand that people feel this is a critical time of change and they want to make their voices heard. I strongly encourage protesters to wear face coverings and social distance as much as possible. And I would urge protesters to get tested. I myself got tested last week, and while it was uncomfortable for a very brief period of time, it wasn't too bad. And I'm also glad to report that my test was negative. Now I'd like to turn to higher education and the guidance we are giving our colleges and universities about how to slowly return to in-person classes. You'll recall that we announced similar guidance for our pre-K through 12 schools earlier this week. The guidance for institutions of higher education is similar. They can begin to reopen their campuses and offer in-person instruction, but they must follow all relevant guidance in the phases outlined in our Forward Virginia Plan and in public health guidelines. The institutions must meet certain public health conditions in order to reopen their campuses, to ensure that there are positive trends in public health data and that their community has adequate surge health care capacity. Institutions must also submit comprehensive reopening plans to the State Council of Higher Education for Virginia, which will review their plans for compliance to relevant guidelines before they can proceed with reopening their campuses. We have one of the best and most diverse systems of higher education in our nation. Our institutions range from large to small, heavily residential to commuter, from urban to rural and beyond. That is why each institution will take on this challenge in a way that meets their unique mission and circumstance. But at all times, their plans must be based on the best available public health data, including the Virginia Department of Health's higher education testing guidance. Peter Blake, who is our director of the State Council of Higher Education, is with us today to discuss this guidance in greater detail. Peter, welcome. Thank you.
Good afternoon. I'm Peter Blake, Director of the State Council of Higher Education. It's my pleasure to be here. Thank you, Governor. Thank you. Good afternoon. We've been shaken by the events of the last several weeks. The conversations taking place in Richmond, my hometown, for nearly 60 years, have been especially meaningful. What has happened recently is a manifestation of injustice and racism that has existed for too long. It is time to confront these inequities where we work and live. In higher education, as good as we are at instruction, research, and service, we still face many challenges around racial equity. Black and brown students attend and graduate at lower rates than other students. Our faculty members are not as diverse as our students. The way we finance our higher education system is imperfectly aligned with what we say we want from our colleges and universities. Yet we strive to improve. There is no other option. Because of the leadership of Governor Northam, Chev recently received a grant from the Lumina Foundation, one of the most significant national nonprofit organizations that invests in higher education. The purpose of the grant is to close achievement gaps in higher education. That's a priority for the governor and for Chev. As Virginia moves forward, there's much work to do. The COVID-19 pandemic threatens the gains we have made in closing learning gaps, as we heard earlier this week. The digital divide is real and contributes to these learning gaps. Expanding student access to devices and broadband is mission critical, especially now. The reopening guidance the governor unveiled today places public health at the forefront. The governor also challenges our educators to ensure that high-quality teaching and learning is preserved and enhanced. The plans institutions develop will protect our students, faculty, and staff, and forge a path of opportunity and equity in the years to come. It was for this very sake of keeping Virginians safe that on March the 30th, the governor ordered all of Virginia's public and private colleges and universities to cease in-person instruction and limited access to campuses to essential personnel only. As we have moved from Phase 1 to Phase 2, and as we anticipate Phase 3, institutions across the state are beginning to put plans in place to safely reopen their campuses. The guidance the governor announced today, one of the first of its kind in the nation, covers all public and private degree-granting institutions. It was developed in close consultation with the Virginia Department of Health and the Office of the Secretary of Education. I want to express my gratitude to Commissioner Oliver, Dr. Furlano, Secretary Carney, Deputy Secretary Bradford, and many others, including Ann Holton, who's the president at George Mason University, for their contributions to these plans. With this guidance, Virginia's public and private colleges and universities can begin the hard work necessary to reopen their campuses. They must do so while following all relevant guidance outlined in the Forward Virginia Blueprint and other relevant public health guidelines. Institutions must meet certain public health conditions, as the governor said, as they reopen their campuses, to ensure that there are positive trends in the public health data, that their communities have adequate health care surge capacity, and that they ensure a climate of adherence to sound public health principles. Institutions also, of course, must follow guidance from the CDC, the Virginia Department of Health, and the phases outlined in the Forward Virginia Blueprint, including enhanced social and physical distancing, health and hygiene procedures, cleaning and disinfecting measures, and other mitigation strategies. Institutional plans will address not only the safety of the students, but also the health of the faculty and staff, many of whom are from vulnerable populations and have become frontline workers during the pandemic. The plans also will consider the needs of communities that are home to our institutions. Institutions must submit their comprehensive reopening plans to SCHEV, which will review those plans for compliance to this guidance. As the governor said, we have a diverse set of institutions, large, small, public, private, heavily residential, commuter, urban, rural. So each institution will take on this challenge in a way that meets its mission and circumstances. While the plans will be unique to an institution, at a minimum, the plans must address the following considerations: repopulation of the campus, monitoring health conditions to detect infection, containment to prevent spread of the disease when detected, and shutdown considerations if necessitated by severe conditions or public health guidance. Institutions may need to update their plans as further information emerges, especially in the areas of testing, contact tracing, and symptom tracking. SCHEV stands ready to assist. The Virginia Department of Health and the local health departments will continue to work closely with colleges and universities, providing guidance, data, and assistance as they have done all along. As we look to phases 2 and 3 and beyond, and as institutions begin to shift to in-person instruction and campus activities, expect a new normal. More courses will be taught in an online or hybrid manner. Classes will be smaller, schedules will be staggered, residence life will be spread out, food service will be offered in non-traditional ways, and large-scale events such as performing arts and athletics will be a new experience. Institutions already have begun to announce some of these strategies. While college life will change, the energy, creativity, and commitment shown by college and university faculty and staff will ensure that the learning experience will not be sacrificed. All Virginians appreciate their tremendous work. Chev will issue further instructions tomorrow morning regarding the reopening plans and the submission process. For now, Governor, speaking for the hundreds of thousands of students, faculty, and staff across Virginia, I want to thank you for your leadership and for providing this important guidance to our institutions in the Commonwealth. Thank you.
Peter, thank you so much, and to please pass on to other members of Chev how much we appreciate their efforts. As you all can tell by listening to this, a lot of work has been put into this, and again, we want our students to be back on our campuses this fall, and we want to do it safely and responsibly, and I just thank them for all of their efforts. I also want to recognize that President Ann Holton is with us today. Ann has extensive government experience. As you all know, she has been a judge, a former First Lady, former Secretary of Education, and is interim president of George Mason University. So, Ann, it's a pleasure to have you here, and just thank you and your husband for all of your wonderful service to our Commonwealth. Thank you. Ann has done just a tremendous job leading one of Virginia's flagship universities, and I'm grateful for her service. On July the 1st, Gregory Washington will become George Mason University's 8th president, and I look forward to working with him. And finally, I'd like to turn to our May revenue numbers. As we all know, the restrictions on businesses and public events during this pandemic have resulted in losses of jobs and of income, and our state revenues absolutely reflect that. For May, our revenues are about 20% below where they were in May of 2019. However, this is slightly better than we anticipated, and I'd like to ask our Secretary of Finance, Aubrey Lane, to come forward and to put these figures in context. Aubrey, thank you.
Thank you, Governor. Aubrey Lane, Secretary of Finance. As the Governor mentioned, it was about 90 days ago when the state first started beginning to feel the impacts of the COVID-19, not only on our businesses, but also on our state revenues. And as you recall, obviously the Governor has said from the very beginning this public health crisis was going to result in an economic crisis. It was a time of a lot of uncertainty, not only related to the health crisis, but some of the actions that we took, like delaying income tax payments that would normally come in May 1st to June 1st, really complicated how we would look at the revenues for the final quarter of our year, which ends June 30th. So at that time, based on the data we had, we estimated that we would be down about $1 billion for this fourth quarter in the fiscal year of 2020. And if you go back and look, in April of this year, our revenues were down 26%. And the Governor has just announced that as of May, our revenues were down another 20%. And this represents about $800 million below what our projected revenues were going to be for the quarter and for year to date in our plan. And as I said, we projected that to be $1 billion. So this is better than where we thought we were going to be, because remember, in June, all those tax payments that would have come in May or April in the previous year are now going to come in the month of June. So almost all of the loss that we've incurred so far is in what's called non-withholding, or the payment of payroll taxes from the previous year and some estimates for the current year. So while we have about 19 days left in our fiscal year, it looks like we're going to be, I won't say significant, but better than what we projected. Now, I think this has to do for a couple of reasons. One, the underlying resiliency of the Virginia economy. The Governor has mentioned several times that we were very strong in our economics before we went into this, and that has helped us through this time. In fact, if you look at payroll withholding, the largest portion of our revenues across all businesses, for the months of April and May, we were down about 4.5%. Now, the headlines have been a lot more than that. I mean, some businesses have closed, and they're obviously very significantly impacted. But many have been able to remain open because of teleworking and our reliance on defense spending and the federal government. In fact, some of our largest employers have seen hardly any decline in their payroll that they have paid the state over this period of time. It also has to do with the federal actions taken, whether it's through the monetary policy of making sure our financial markets work well and giving businesses confidence, but also the payroll protection plan, where the federal government gave money to businesses so they could retain their employees. And of course, by doing that, they were able to pay us. So this is not by any means that everything is great and it's an all clear. It's still a very difficult time for the state and for many businesses. But you just heard the governor mention a little while ago about how the virus seems to be abating in the Commonwealth. Well, while that's happening, business activity is picking up. You saw the jobs report last month in the nation. We actually called back 2.5 million workers. The same will hold true in Virginia, because it appears that we're much closer to a bottom than we were a few months ago. And that doesn't mean it's going to turn around quickly by any stretch. But what this does mean is that we will have good data points as we forecast our revenues for the new biennium budget. And so that will happen, the governor mentioned the other day, sometime in the month of July, and he will call a special session at his pleasure sometime later in August, where we'll discuss all this. But just wanted to point out that with all the calls of uncertainty, it looks as if Virginia, at least through this fiscal year, is going to be within what we thought was going to happen. The actions we took the governor took by suspending discretionary spending, by suspending capital payments, have also helped to build our cash reserves. So it appears that as we go into the end of this fiscal year and go into our next biennium budget, we'll be starting from a place that we can get a forecast from that would be meaningful and not just based on political rhetoric or some headline that doesn't represent what the underlying economics are in the Commonwealth. So with that, Governor, thank you very much for having me today.
Thank you, Secretary Lane. In closing, I want to reiterate how important it is that everyone continue taking this pandemic very seriously. While we are all adjusting to how to live in this, what we call new normal, it's not smart to act like the virus has been eradicated, because it has not. It is still here, it is still dangerous, and we must continue to be cautious. So now I'd like to ask our Virginia Health Commissioner, Dr. Norm Oliver, to give us a health update, and then we'll be glad to take your questions. Dr. Oliver, thank you.
Thank you, Governor. Good afternoon. I want to report what we posted on our website today with respect to the numbers on COVID-19 within the Commonwealth. The total cases now stand at 52,647. That's 470 new cases reported in the last period. As the governor mentioned in his remarks, cases have been declining over the last several days to weeks. Total deaths stand at 1,520. New deaths recorded in the last 24-hour period is just 6. The total tests that we've performed in the Commonwealth are 453,869. That in the last reporting period, we recorded 9,053 new PCR tests and a little more than 1,300 serology tests. The number of African American cases stands at 7,350, which is still around that 20% level. Deaths among African Americans stand at 326, which is around 24%. In the Latinx community, we have cases that now number 17,810 and deaths at 149. The cases are 50% of those that have race and ethnicity recorded, and the deaths are at 11%. Next week, we hope to be able to have more information regarding racial, ethnic breakdown in cases, hospitalizations, and other things. We've been working diligently on that for the last several weeks, trying to get more granular in that information. As you may have recalled from previous news conferences where we've talked about the incomplete nature of the data we have there, the complexity of that data, as well as, frankly, the messiness of that data. We've been working to try to work through all that so we can provide more information. We'll have more news on that next week.
Dr. Alva. Thank you. Cam, I'll be glad to take questions.
Governor, first regarding the university guidelines here, I know some of the universities have already put out what their reopening plans are. Are those now moot, or are these something that they'd already been working with the state on in regards to that? And then switching to the protest topic as well, I know one of the...
We'll come back to that one. I'll come back to you in a second. Peter, do you want to address the first part of that question? Thanks.
So the question was, many of the institutions have begun to put plans in place already and or have announced what they might be doing this fall. And we have been working very closely with them over the last several months. President Holton could mention that as well. But as the governor and I both have stated, these are individual institutional plans. So this guidance, they might need to enhance portions of them. But as a whole, they're going to be able to incorporate whatever it is that this guidance does. So I'm comfortable with it.
Submitted a plan that's been approved as of yet based off these guidelines?
No.
Thank you, Peter. Cam, what was the second part?
The second question was regarding with the protests. One of the messages that has come out about this is the defund the police, of removing funding from police forces, putting into social services programs. Where do you stand on that call from protesters?
Yeah, I think a lot of semantics, Cam, has been used, and certainly one of them is dismantling the police, and I certainly don't support that. Our police officers provide a much-needed resource to our communities. When we talk about funding, I think we really need to talk about reform and the priorities of how we spend the funding. And so, as I said on Tuesday, I have had very candid and frank discussions with our police chiefs. I'm in almost constant communication with our director of our sheriff's departments and also our state police. And so there are certain areas that I think that we can really start with, again, getting input from community activists, community leaders, getting input from our police force, and also from our legislators. But things like really trying to work on increasing the diversity of our police staffs. And that's something that is not new. We've been working on that in the past, but we'll continue to do that. I think another area that's important to talk about is what I would call co-responding. There are a number of individuals that are potentially breaking the law that have mental illness. And our police forces, while they're trained somewhat in that, I think it'd be much better to have someone that's truly trained in how to deal with mental illnesses. And so that's been discussed. I think there are opportunities to really get into the communities more and make sure that people in our communities know that our police officers are there to protect them and to make sure that they're safe and also that they're respected. The communities are respected. So that's an area. De-escalation techniques is something that we've all talked a lot about. And then finally, something that I have spoken about, Cam, in the past is body cameras. And I think the reason that the allegations were made in Fairfax was because of a body camera. Now, and I'm going to come full circle here with your question. Body cameras, there's I think a need for them, and it's a great resource, but they cost money, and especially reviewing the film, and that falls into the purview of the Commonwealth's attorneys. So when we talk about defunding, I wouldn't look at it as defunding. I would look at it as how do we best prioritize the funding that we have. And so that's kind of a long-winded question, but that's the way I would approach it. And I think that's the way the police departments want to approach it as we discuss reform.
Bruce Potter with Inside Nova.
Governor, what is your timeline for phase 2? Should businesses be looking to have more access or loosened restrictions in weeks? Or should they be looking at months or in the fall? What's your timeline for phase 2 and going into phase 3?
Thank you for the question. The question is, what is our timeline? And a minimum of 2 weeks. And you all, I showed you the data today. The trends are very favorable. We will continue to watch these on a daily basis, watch 7-day trends. Right now, things look good. And I encourage all Virginians, don't let down your guard. We need to keep doing the great things that you all are doing. But certainly the amount of PPE is important, and Secretary Moran, who is with us today, and his team have done a phenomenal job. Our ability to test, as we have reported, gets better every day. Our hospitalizations are trending down. The staffing is certainly adequate at our hospitals. The equipment that we need in ventilators, those types of things, we're in good shape. So we'll continue to monitor it, but a minimum of 2 weeks, and we'll just have to take one day at a time. And I know we're going to be back with you on Tuesday, and we'll look at the data. We have 4 to 5 days between now and then, and we'll look at the data over the weekend, and I will try to give the businesses, and again, I know this is so important to our businesses, but give them the guidance they need as to our best thoughts on when we will go into phase 3.
Business owners who've contacted us who say it's sort of unfair that they can't be fully open, but there are thousands of protesters in the street without masks, not socially distancing. What do you say to those business owners who have a valid argument here?
Well, I appreciate the business owners. I'm a business owner. We've obviously had to make a number of modifications in our medical practice, and I just thank our businesses because for the most part they have really abided by our guidelines, and we're where we are today because of the sacrifices they have made. So that would be my message to the business owners. My message to protesters is we're all in this together. We all need to be part of the solution, and while I understand the rights that Virginians and Americans have to protest, we have to realize we're in the middle of a pandemic, and it's not just about taking care of themselves, but it's taking care of others, protecting others as well. And so, as I offered in my comments, Henry, I encourage the social distancing. I encourage the wearing of facial protection, and we also strongly encourage these individuals that have been out there and not had facial protection, have not abided by the social distancing, to get tested. And that's why I made the point that I have been tested and a lot of other individuals have been tested, and so I would ask them to please strongly consider that.
We'll go to David McGee with the Bristol Herald-Courier.
Yes, thank you, Governor. I want to revisit, go back to Tuesday and the K through 12 guidelines. There's very few cases in Southwest Virginia, and on Monday, the Bristol Virginia School Board expressed an interest in opening normally. Is there any thought about potentially allowing some divisions that have areas that have very few cases to allow schools to maybe enter phase 3 sooner than other regions?
Yeah, I'm going to have Dr. Lane, who's going to make his way up to the podium, but I'm going to kind of go back to what I've said all along. We've put a floor in place, and while we don't want anybody going below the floor, we've allowed certain areas like Northern Virginia, Richmond, the Eastern Shore to raise the ceiling, if you will. But I suspect Dr. Lane can kind of explain this a little bit better, but he will be looking, as our Superintendent of Public Instruction, on the plans that are being proposed by the different school localities. Dr. Lane, thanks for joining us today.
Thank you for the question. In the governor's phased guidance, there is a bullet in a sentence that allows the state superintendent to consider variances on a case-by-case basis. In places like Southwest Virginia, where there's been very little transmission, we do anticipate that variances may be considered, and look forward to seeing what those look like when they come back from the school divisions.
I know that at the end of the month, the state's contract with Northfield for procuring PPE is set to expire. So I was wondering if you could tell us if that contract has been expanded, or any other contract has been entered into to source PPE.
Yeah. Brian, you want to address that? The question is about our contract with Northfield, who, by the way, is a Virginia company and have just been great to work with. They've done excellent work. And as you all remember, when this process started, governors were literally competing with healthcare systems, with other governors on our supply of PPE, and they've really been phenomenal to work with. Brian, if you want to address the question, thanks.
Thank you, Governor, and thank you actually for the question. The PPE story has been one of ups and downs from the beginning, how difficult it was to obtain PPE, but over the course of several months now and working with a variety of contractors, one specifically Northfield, a large shipment, just this week we were able to make 138 one-time deliveries of 1,000 cloth masks to each of the 138 recognized emergency management political subdivisions. We have 252 total shipments went out yesterday, 239 to localities, assisted living facilities, institutions of higher ed, community colleges, 7 regional healthcare coalitions, and 6 state agencies, and the list goes on. Gloves, I won't go through all of this, but N95 masks, surgical masks, gloves, so forth. So with respect specifically to Northfield, that was a contract that was negotiated. Additional shout out to Secretary Lane. Working with them was a $27 million contract early on in this crisis, and one that really has panned out. It's done very, very well. We received 3 large shipments. Those conversations are going on. We'll continue to be, we'll continue to have those conversations. We've have over a dozen PPE-related contracts to diversify our supply chain, and so we'll continue to do that. And we've continued to actually develop Virginia manufacturing opportunities. We have at least 2 facilities and another one right here in Richmond we may have a very exciting announcement on in the near future to manufacture PPE right here in the Commonwealth, creating jobs here in the Commonwealth, obviously improving access to that PPE as well, not relying on international shipments. So it's been a challenge, but one I think we've done extremely well at, and we'll continue to pursue, though, because we recognize it's one that we'll need to continue to pursue. So
right now, the Northfield contract is still being discussed, but not finalized.
That is correct. We'll continue to. They've performed well, and we'll continue to have those negotiations. Yeah. Thank you, Governor.
Hi, Governor. Thank you so much for the question. I'm wondering if there were any arrests made in connection with the pulling down of the Jefferson Davis statue in Richmond and in connection with the damage to the statue in Portsmouth. And if there haven't been, are police looking for people in connection with those incidents?
The question is, were there any arrests made because of the taking down of the Jefferson Davis statue? And Brian, do you have any?
I'm not aware of it.
I'm not either.
Be a Richmond PD question.
Yeah.
Is that a question for the Richmond Police Department?
Yeah, I don't know if you could hear Secretary Moran, but I think that's a question better addressed to the Richmond Police Department, because they would have the data on that. Andre.
Thank you, Governor. Piggybacking on that question, a lot of people are wondering what are your thoughts on some of these protests that are peaceful but turn violent. Are the police departments wrong for standing back, standing down, and watching this destruction take place? And then on sidebar, if I may, Democratic Senator Chap Peterson, along with Republican Senator Mark Peake, had some concerns about some of the legislative or some of the rulings that you've made without legislative approval, wondering when will you wrap up the state of emergency, and would you consider calling in a special session to talk about some of these maneuvers, if you will?
Okay. Two questions. The first was as far as the police department's response to the protest, to the tearing down of statues, that type of thing. You know, I haven't involved myself as the governor. That's really a a police department decision, Andre, that's made on as far as how and what type of enforcement they do at the scene. So again, that's a question that would probably be better answered by them. As far as the second part of your question, Senator Peterson has filed suit against the Commonwealth of Virginia, and my policy, twofold. One, I believe that everything that we're doing, Andre, is constitutional. I work very closely with our counsel. I work very closely with our Office of Attorney General. But anything in addition to that, comment-wise, I just assume not comment because it's in litigation right now.
And the special session, would that also apply? Would you not consider that? Or?
Well, as you know, the question is about the special session. We have to have a special session because we put our budget on hold. And so the timing of that will be when we do our reforecast, which, as Secretary Lane said, will be in July. And then I don't have an exact date, and we're actually discussing, that date with our legislators, when the most convenient time would be. But probably kind of in the mid to later part of August. Again, there are a lot of different discussions that go into that, Andre. As you see today, we have folks from higher education. They need to plan their budget, so we don't want to push it back too far because they start hopefully having students on their campuses in late August, early September. And then I think another part of the question, maybe I don't know if you were included or intended to include it, is what will be taken up in special session. Will we be talking about police reform? Will we be talking of things that we can do in addition to what we've already done with criminal justice reform? And that's also a discussion that I will be having, we are having with our legislators. When I call a special session, it will be regarding the budget. If there's anything in addition to that that's legislation that's introduced for whatever reason, the General Assembly, by a majority vote in both the House and the Senate, have to approve of moving forward with discussing that legislation. So those are discussions that are ongoing, and I don't have a commitment from the House and the Senate as far as what they would like to entertain. But I do know one thing. We will be back sometime in August, and we will be discussing our budget.
Tracy Agnew with the Suffolk News Herald.
Thank you. With continued remote instruction in some form seeming likely when the K-12 schools start again in the fall, does the state have any specific plans to implement over the summer that could improve access to devices and broadband for low-income students and those in rural areas?
The question is broadband, and I've said today's conference was going to be brief, so I will keep my response brief. There is no better example of why broadband is important universally in Virginia than COVID-19. And it's brought in issues with health care, it's brought in issues with access to education, all of these being equity issues. And it has been a top priority of mine since I took this office. And the first year we had about $4 million in the budget. We then had 19 last year for broadband. This year we agreed to, I think well over 34, 35 million. And obviously we've had to hit the pause button on this year's budget. But we need to make that a priority. And we have resources from the federal government. I actually have a meeting with them tonight with our congressional delegation. And we will continue to push for any resources that we can obtain to really funnel that into broadband. And again, it's a public-private relationship as we move forward, but it's obviously going to require resources, and it's certainly a commitment of mine. And I really think it'll be a commitment, nonpartisan. It's not politics in this particular case, but it's going to be a commitment of all of our legislators to really make sure that all Virginians have access to broadband. And just, I said I was going to be brief. I promise I will. There are about 550,000 households right now in Virginia that don't have broadband. That's just not right in 2020. So we need to do everything that we can collaboratively to remedy that situation.
Yeah, as you know, nationally, there's conversations about renaming military bases with Confederate names. At least 2 are in Virginia. We know the president has opposed calls to change those names. Where do you stand on it?
Yes, well, these, again, just like the statues, these names are divisive. And we have people serving in our military, whether it be our Guard or active duty, that come from all walks of life. And we promote diversity. And so I would be very supportive of the discussion moving forward. What process will it take to rename these bases and posts across Virginia? And to your point, we have several here in Virginia. And I know our president has spoken out against doing this, but I think that most people, and I can't sit here and speak for everybody, but support removing the divisiveness from the names, whether they be posts, whether they be statues, whether it be the names of streets, whatever. And so I would be supportive of that discussion.
And is that within your authority, or does that fall up to the Department of Defense, federal government, to have a say in changing those names?
That would be the latter. Yeah.
Luann Rife with the Roanoke Times.
Hi, this is Henry Chandro, reporter with the Roanoke Times. Regarding the opening of universities, given the fact that many colleges have announced they will end fall terms before Thanksgiving because of a fear of a possible resurgence, does the state have any public health concerns about how that sort of exodus from campuses occurs? And further, when it comes to January, is the state offering any guidance for colleges to begin now to plan for an all-online winter term?
The second part of your question might be best answered by Peter from SHEB, but Laura, do you want to address the public health issues? Thank you.
Hi, I think the question was about planning for early departure from the fall semester for campuses that have a residential component, and how would we best plan for that. The planning process and the plans that universities have to submit, part of that plan is inclusive of thinking through how to safely bring students onto campus and how to safely help them leave. And that could be either in response to an increase in cases that's not able to be controlled, or just simply the end of a semester. So I think that's part of the planning process. There's certainly public health implications to that. But really, I think a lot of what they already do to plan that can be put into place, staggered exits, et cetera. So I think they're well on their way to thinking through that. And we've asked them to do that as part of their planning.
The second part of the question referred to online instruction and whether or not institutions might need to have full-time online instruction at some point, either this semester or in the future. Part of the plans that they'll be submitting include shutdown considerations if it is required through either a severe condition or some public health guidance. So they will be submitting plans that have, I would imagine, emphasis on online instruction. You may recall that in the spring, there was, after March 30th, a wave of online courses across the Commonwealth. I think, President Holton, something like 30,000 courses. Colleges, universities, just the public colleges and universities converted 30,000 courses from in-person instruction to online instruction. So they have the capacity to do it. They're getting better at it, and their plans will reflect that possibility.
Yeah, as you talk about law enforcement reform, do you think that there's need for reform in the area of police accountability and excessive use of force, and is that something that you think we might see during the special session? You also mentioned that you met with representatives of law enforcement and that has informed your thinking about reform.
I'm sorry, Mel, I got the first part of your question, but if you could speak up just a little bit on the second part.
You said that last week you met with representatives of law enforcement and that has informed some of your thinking on reform. Have you also met with civil rights groups, and what are the things that they've said that maybe have also resonated?
So I appreciate the question. I think I have it. The first part was when we talk about reform of our police departments, will use of force be discussed? And absolutely. And I will continue to have that discussion, that dialogue with our law enforcement experts. And also, I think leading into the second part of your question, have I met with other individuals? And I have met with some, and I'm also in the process of setting up town halls across Virginia. We're scheduling those as we speak to get community input, activists, local leaders. All these folks are very important to be at the table as we move forward with reform. And that was part of the discussion. It was on Tuesday with the police chiefs, and I think they're going to be very amenable to working with these different groups to really look at reform and be able to move forward. I thank you all again for being with us today. One of the things that we try to do, and I just wanted to emphasize this, is when I say we, our cabinet secretaries, our agencies, is really to have an open line of communication with our local officials, VACO, VML, to give you two examples. We have weekly conversations with our legislators and also weekly conversations with our congressional delegation, our two United States senators, and then our congressmen and congresswomen. And so what I would encourage you as we move forward, there are a lot of questions, a lot of different situations out there that we obviously haven't maybe thought of. We've tried to be as thorough as we can, but I would encourage all of you, if you go to our website and don't get the information that you need there, to please communicate with your local representatives. They're there to serve you just as we are, and they can in turn bring your ideas to us, and then we can help to turn those into policy and into action. So in the meantime, it's Thursday. I hope that everybody continues to follow the guidelines. It's working. It really is, and we're getting to a place where we need to be. And as I've said all along, this health crisis has been our top priority, but we're also in the middle of an economic crisis. And as soon as we can put this health crisis behind us, our economy will be up and running again. So thank you for your cooperation. I hope you have a safe and peaceful weekend. Thank you.